morning. Thank you so much for joining us for our coffee conversations today. We are so excited to have medical oncologist Dr. Salvador here with us to discuss integrative oncology. We are so fortunate that she was able to join us today and educate us on this topic. So, Dr. Salvador, could you please tell about you?
Yes, well, as I said, good morning to everyone. And let me tell you a little bit about myself. First of all, I have an accent, so I want to start with that. I'm originally from Spain, but I did my medical school and my training in medicine all in the States. I'm a fully trained hematologist, oncologist. I'm board certified in oncology. And I started on my practice right after fellowship. I did my fellowship at the University of Louisville in Kentucky. I'm specialized in breast cancer. And throughout my course, the course of developing my practice as a full physician oncologist, I realized that we may have cured cancer in some people, but there were some side effects that sometimes limited the quality of life of the patients, and I wanted to do more for them. And I started to look at different things that we could do, and I ran into a fellowship in integrative oncology, and I researched in integrative medicine, not integrative oncology. I researched, found it very interested and wanted to learn a lot more. So I enrolled in the fellowship, and I went through the training. I opened an integrative clinic, actually at UAB in Birmingham. So that was my first clinic that I opened as an integrative oncology doctor. So has been very rewarding because I have continued my breast cancer clinic as well as my oncology integrative clinic. So it's just a wonderful thing to have this kind of combination. Does that answer fully your question?
Yeah. It does, and it was nice to have you in Birmingham. So, when we hear integrative oncology, everybody might not be as well versed as to what that means. So if you could you just break that down for us? What is integrative oncology? Where does this practice originate from, and how is it incorporated part of people's treatment today?
Yeah, so integrative oncology comes just as a natural succession of the integrative medicine itself. So what happens, like in internal medicine, you have different specialties, and one of them is oncology. So it's the same thing with integrative medicine. Integrative oncology is just a subspecialty of integrative medicine. And what integrative medicine is the medicine that takes care of the whole person, tending to body, soul, and society. So taking into account also what kind of relationships the patient has. Is not different. The integrative oncology is not different from integrative medicine. It's just that part of integrative medicine that applies to people living with cancer.
And I think that's so great that you pointed it out. Like,
and just to give you a little bit of time reference, officially, the Society of Integrative Oncology got funded in 2003. So it's coming to its close to its 20th anniversary next year. And it has been very active in trying to promote not only what integrative oncology is and the care of the patient, but also, I lost my train of thought, sorry. Also trying to change what insurances cover and do not cover of all the different modalities that we offer.
Okay. And I was saying earlier, I think that it's great that you pointed out that, integrative medicine is the holistic approach, right? But there is a specific, lane for oncology, for cancer, which I think is really important to know. So what are some different methods that a person can use when they're thinking, okay, well, integrative oncology seems like something that would benefit me? What are some things that are beneficial when it comes to incorporating integrative oncology in someone's treatment?
Definitely. First of all, I think that we should talk about the different phases of a person living with cancer. First you're diagnosed and you go through the treatment, and then after treatment, you start your survivorship. And sometimes some people will live with cancer the rest of their life, whatever that span may mean. And nowadays, especially with breast cancer, we have a very long survivorship of patients living with cancer. So it is slightly different from each period, and that needs to be addressed separately. And as such, for instance, there are new guidelines on exercise and diet for patients living with cancer during treatment. And what they have come out to say is that exercise is very, very important during treatment. Of course, it's also important after treatment, but this is specifically recommending it during treatment. That as of now, we were more inclined to tell the patients, oh, if you feel tired, do not exercise. Now we want them to exercise, and we are starting to create ways to provide the support for the patients to do it safely, because not everybody can afford a gym, not everybody can afford a trainer, et cetera, et cetera. So I think that having these guidelines coming out from ASCO, American Society of Clinical Oncology, which is the main society for oncology in the United States, is very important. And that comes because when we think about how do we take care of our person, the whole person, two things that come to mind immediately is, well, with good nutrition. And what does good nutrition means? It means to have a balanced diet. There are many diets that you can follow, and I'm very much recommend a Mediterranean type or DASH type diet that incorporates all kinds of food, but also highlights the use of antioxidant fruits, fish, and vegetables, and we can extend that a lot more. Nutrition is very, very important, and what you put in your mouth is incredibly important for your overall health, whether you have cancer or not. And then to have a routine that you do for physical activity, whether it's walking, running, biking, whatever suits you. But the recommendations are to have some type of aerobic exercise for about 150 minutes a week.
Okay.
And then alternating that with 3 times a week, some resistance exercise that you can do. And that can be done by our normal weights, by elastic bands, etc. And I think that most people can do it safely, but it's very important to make sure that you're doing it right, because you can hurt yourself.
Mm-hmm.
The other thing, then we come to what about other mild types of exercise, and people start thinking about maybe yoga, Tai Chi, Qigong. There is a lot of studies done with yoga and less on the Tai Chi, Qigong, and it's for that on the guidelines that we had coming out in 2017 from ASCO again on integrative medicine for breast cancer. Yoga was one of the major recommendations, but in 2017, we didn't have a lot of data on Tai Chi and Qigong, and this was not highlighted on those recommendations, but hopefully in the newer recommendations will be highlighted. And yoga is very beneficial. Yoga is a type of activity that incorporates a little bit of body work and mind work.
Mm-hmm.
So you do your exercises and stretches with breathing exercises, and that is very helpful for people with anxiety and depression, very common in people diagnosed with breast cancer, of course.
Mm-hmm.
How can you not get anxious when you receive the news of having breast cancer and living with it?
Mm-hmm.
So I think that is a good recommendation of the things that we do in integrative medicine. There are many modalities that we can talk about. So I don't know if you have any in mind or if I just keep talking.
No, so I mean, I'm just learning. I'm just sitting here learning. And one thing that I did want to kind of touch base on, I know you mentioned, and of course, like diet and exercise is always important, like no matter if you have cancer or not. But when we're discussing oncology, and I know you mentioned how studies showed that, physical activity was such a huge component. Can you just kind of unpack that a little bit? Like what makes it so impactful for individuals diagnosed with breast cancer?
The fact that it contributes to the well-being of the person.
Mm-hmm.
Usually people undergoing treatment, they are very fatigued. They may feel some side effects from chemotherapy, like neuropathy or nausea.
Mm-hmm.
And the anxiety, physical activity can help with all of that a little bit.
Mm-hmm.
And every person is going to be different on how they will be helped by it. Mm-hmm. So some people will feel the benefit immediately, while others may need a couple of weeks
mm-hmm.
to get to feel that they are being helped by what they are doing. It's a little bit also how our body reacts to this. If it's a person that hasn't exercised
Mm-hmm.
prior to being on treatment for breast cancer, there should be some recommendation of starting slow and building up.
Yeah.
One thing that you don't want to have in a patient undergoing chemotherapy treatment is for them to get exhausted. Mm-hmm. And then have 2 days that they don't want to move. Mm-hmm. We want them active every day a little bit. Mm-hmm. And it's very important to discuss that with your doctor, to discuss if there are resources available the person can visit and make a plan for it. Of course, in the last 3 years, we have been very limited because of the pandemic on how we can visit gyms and things like that and have trainers, et cetera. But now that, we are starting to breathe a little bit easier, maybe it will become easier. Some trainers can do it online. Also, the YMCA through the Living Strong Foundation, in some centers of the YMCA have specific programs of exercise and rehab for people undergoing treatment and survivors. So post-treatment, I'm referring to survivors as people that have finished treatment.
I like that you pointed out that it's okay, even if you weren't practicing these things before diagnosis, because realistically, everybody doesn't, exercise. I'm just now in my life trying to get back to exercising. So, it can be a challenge, but it can discourage you, but it's okay to still have those conversations to see what's realistic, like what's doable. Like, I like that you mentioned, like, just talking to your doctor about like what is achievable and what's not achievable can make a huge difference, and being patient with your body is what I'm hearing you say, basically. But it's okay if you can't run a mile. Most people actually can't. It's okay.
Yeah, and it may be something that you mentioned to the doctor. Sometimes, the doctor may not have time to address it fully, but you can talk to the social worker and the cancer navigator on the team, or even the coordinator of the clinic, of your clinical care within the cancer team. You can talk to everybody, or even your nurse when you're getting treatment, so they can find the information for you. So the most important thing that I want also to transmit is that it's very important to do it in a safe way, and knowing that what you're doing is good for you.
Which is why it's really important to include your medical team. Just because you don't want to do something that will hurt you. You don't want to do something that's contrary to whatever you're doing as far as your active treatment may go, or even post-treatment, if you just still need to take your time. Yes, that it's super important to include your medical team, whomever that may be. What are some other updates and findings that you all have found as it relates to integrative oncology, and how someone might be able to incorporate this to their current, or when they're in treatment, or post-treatment? Are there any new findings?
New or not so new, we have known for a while that mindfulness is a very powerful technique to help with anxiety, depression, the intrusive feelings sometimes that you have when you have gotten a diagnosis of cancer. And there are places where you can learn how to do mindfulness and mindfulness meditation. And I think that is another incredible tool for anybody, but in particular for people living with cancer that feel a little bit, what else can I do for myself? Can I do this while I'm doing treatment? Absolutely. For patients undergoing treatment, sometimes they can use acupuncture if they are still feeling nauseous or experiencing some vomiting that is not controlled by the medications that they are given, and they can discuss that always with the doctor, and then see a good acupuncturist. I always tell my patients to make sure that the acupuncture that you visit is a licensed acupuncture and that has treated people with cancer before. The same for massage, the same for anything related to integrative oncology, to have the experience to have dealt with and treat patients that have cancer is one of the prerequisites that I think the patients need to ask for, no matter what. So I think acupuncture is very helpful, massage is very helpful, and it can help with pain, both acupuncture and massage. And actually, ASCO also released this year, earlier, the guidelines for pain. And with respect to people with breast cancer, they have a good recommendation for acupuncture when the patients are experiencing joint and muscle pain from aromatase inhibitors. Those are the anti-hormonal treatments that we have for patients that have estrogen or progesterone receptor positive breast cancer. And that has been proven to work. Once again, it doesn't work on anybody, and insurance may not cover it, so cost is a concern, and you may need to discuss that with the acupuncturist practitioner. The other thing is massage can help with some of the pain, but not everybody can get massage, and not everybody should get massage. So you need to discuss that with your doctor, and then find a practitioner, masseuse, that has experience in cancer.
Yeah, and I like that you keep mentioning, to make sure that you're talking with your doctor, because this might work for somebody, but this particular thing might work for somebody, whether it's massage or acupuncture or whether it's yoga, it's not for everybody. So talking to your doctor about like what your what treatment you're doing, and all of those different type of components that go into those decisions are just really key in finding out what works best for you all around. So it can help you with your mental being, like with the mindfulness, right? Like if we want to practice mindfulness, what are some other ways that we can do that aren't necessarily harmful to, my body and what I have going on at this time? So I love that you keep mentioning to always refer back to those types of conversations, because it's so key in helping you make an informed decision that's going to be best for your mind and your body.
And another thing that I want to mention in those lines is because people have a tendency to use natural products, what I call supplements, in a very liberal way, thinking that because they are labeled natural, they may not cause any harm to them. And that is not entirely true. So when you're about to use a supplement, first of all, know why you're using it, and know that, if possible, the data or the support for that symptom that any pill can have. So if you're going to think about, I want to take, I don't know, ashwagandha, for instance, or rhodiola, or whatever herbal somebody may recommend it, or some mushroom pill, etc., etc. Just make sure, first of all, that the brand name is a good brand name. And there are places where that can be checked. Sometimes it's not available to the regular consumer, but any integrative practitioner can check if there is any trouble with any of the supplements that you may be using. So always talk to first your oncologist, of course, and then if you're seeing a practitioner for the supplements, talk to that practitioner and make sure that the brand is reliable. And why am I saying this? Is because this is not regulated by the FDA. So whatever is on the label may or may not be what is on the pill that you're taking. And you're spending a lot of money on those supplements. So please do your best to make sure that it's a reliable brand. And always talk to your doctor. The other reason to talk to your doctor, to your oncologist, is because sometimes supplements can interfere with the medications that you're given if you're still getting treatment for the cancer. And what that is that the supplements can make the medicines that your oncologist is giving you less effective. Mm-hmm. And also can make them more toxic. So you may start feeling more nauseous or more fatigue or whatever. So the doctor needs to know what you're taking and follow the recommendations. If they don't want you to take the supplements, avoid taking them until you're done with chemotherapy. If not, try to talk to an integrative doctor that can assure you that it's okay, and have your oncologist and your integrative doctor communicate with each other so everybody is on the same page and you can be reassured that what you're doing is a good thing.
Thank you so much, Dr. Salvador. You've dropped some knowledge in here. Like, I feel more familiar with integrative oncology, and I'm sure anybody who has participated today or will watch this recording later will feel the same. Before I end our coffee conversation, are there any other final thoughts you'd like to leave our viewers and listeners with?
Yes, always check with your oncologist. And if you have a integrative or somebody that is an acupuncturist, always ask them those safety questions. Very, very important.
Okay. Well, thank you so much, Dr. Salvador. It's been a joy talking with you today.
It's been a pleasure. Thank you.